This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. When the first wave of coronavirus passed, dedicated intensive care units were quietly mothballed. As the figures rise again, though, some are reopening. Among them, the Royal London, the biggest in the capital, which can take in up to 150 patients on ventilators. Our health editor Ross Lydall's here. Ross, this is a strong sign, really, that some doctors are quite worried about what's to come.
Yes, I think this is a pretty good finger in the air to see which way the wind is blowing. Intensive care doctors at the Royal London, the massive hospital in Whitechapel, they couldn't afford to open two of the floors there. The 14th and 15th floors were left essentially in mothballs, just empty shells. There was just nothing in them whatsoever apart from some concrete posts. But when the first wave came March, April time, the trust bosses at Barts Health got some money from the Department of Health to essentially open the floors, and towards the end of the first wave in May, they got the 15th floor ready, turned it into a COVID critical care unit, both intensive care and high dependency beds, and they treated about 30 people there towards the end of it. Then they pretty soon shut it down again over the summer because there was simply no demand. They were almost down at 0 patients. But what they're now saying is that probably the next few days, they will reopen the 15th floor and will use it for critical care for COVID patients. This won't be for all COVID patients, as far as I understand it. This will be rather for the ones who need ventilation.
But there had been, Ross, an apparent fall in the number of infections in London recorded, hadn't there?
Yes, well, I think here we have entered the realms of some pretty dodgy data. So Public Health England publishes weekly figures which shows the incidence diagnosed COVID. I think it's important to say borough by borough. That normally comes out every Friday afternoon, and it can be quite a statistical nightmare to actually crunch the data to work out who's up, who's down, who's staying the same. And what analysis of the figures which came out on Friday showed yesterday was that about 27 of the 33 boroughs had gone down in terms of the proportion of people testing positive, because it's always given as a number per 100,000 residents, which of course didn't seem right at all, because the entire message seemed to be that actually cases were increasing quite sharply in London and elsewhere in the country, but London was one of the two sort of emerging hotspots, if you like. So what happened last night was that Public Health England in London said, essentially, don't believe these data. These figures are only one of several measures we use to calculate the overall number of cases. Because, of course, these particular data relate to people who turn up for a test at a test and trace centre. And one, we know that these are people who have had lots of trouble actually getting tests. There has been a constraint on the number of tests available. And these are also generally people with symptoms. Many people won't have symptoms but will be infected. Hence, we shouldn't really believe any sense that the infections are going down. The more accurate measure, of course, is to look at the number admitted to hospital, which is something you can't argue with. Either there's somebody in a bed or there's somebody not in a bed. And these figures show that in the last week compared to the week before, there were about just over 200 people admitted with COVID to London hospitals. The previous week it was under 100, so it's more than doubled in a week.
I was watching Boris Johnson's statement to Parliament earlier, and he was talking about how the country is much better prepared for COVID this time around. There's better equipment, there's better drugs, and the doctors know better about how to treat it. Is that what medics have been telling you?
That is exactly what Professor Rupert Pearce, the intensive care doctor at the Royal London, told me, that yes, they are better prepared. And they gave me sort of three key reasons why that is. The first is in relation to medicines. There was a steroid that was discovered for use in COVID patients, which was particularly good at reducing mortality, and that's now become standard practice. The other thing they have discovered is the danger of blood clots. A number of deaths were found to have been caused by blood clots passing from the legs and other parts of the body to the lungs, and then causing cardiovascular collapse. And the third thing is just the better use of PPE. The staff now are very well versed at putting PPE on and off, and they also know about creating COVID safe areas, such as they're doing with the 15th floor at the Royal London, areas where COVID patients are kept, and also kept away from others, and reducing the risk of infection spreading within hospital. The other thing they mentioned, actually, which is another key thing in terms of the medicine, is that previously they would actually look to dehydrate slightly COVID patients in the belief that that would protect their lungs. But what they found was that dehydrating them would end up causing a more severe kidney injury. So the combination of using the steroids, not dehydrating these people, and sort of better practices, there is the hope that the mortality rate will be reduced. But of course, there may not be a reduction in number coming through the door. That largely depends on the social distancing measures.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.